There are many challenges in treating epilepsy in low and middle income countries. And some of these challenges are part of the environment. Of these challenges are very specific to epilepsy. And so let me tell you what are the issues. First, there is not enough awareness about epilepsy in many areas of the world. So people often feel that when they have seizures, epilepsy, that's something not really of the body, but could be spiritual. This leads to all sorts of things, particularly stigma, that makes the life of people with epilepsy often very difficult. Then we move on to systems where diagnostic facilities are not always easily available. And indeed, it's the exception that you will have facilities for diagnosing of epilepsy, starting on the specialist. So we heavily rely on people working in primary care to diagnose epilepsy. That's not a big problem if we train well primary care workers to diagnose convulsions, but it's even more of a challenge if we want them to then also diagnose focal seizures. Then we will move on down the line, the lack of specialists, the lack of diagnostic facilities, not of really sort of the health environment, the health ecosystem is not developed. But we also have the problem of the drugs, the medications that can help people with epilepsy. And it's fair to say that with appropriate medication, well over 70% of people, they become seizure-free and they can be easily integrated in society and they can be, get on with their life. But anti-epileptic drugs are an issue, anti-seizure medication as we call them nowadays. They are a real issue because they're not always available, they are not accessible, they often are not affordable, particularly in situations where you have a system that does not provide for reimbursements or universal health cover. So, and you can see this in many parts of the world. The expenditure for health per capita is well below the cost of some of the drugs that we use to make sure that people don't have seizures. So there are a number of issues that we need to tackle, and we need to bring down the number. We need to increase the awareness about epilepsy so people understand that epilepsy is really a medical condition and can be helped, can be improved, and to help people lead a normal life. The second thing is we need to improve the diagnosis. And improving the diagnosis, we need to improve the knowledge about epilepsy and training health workers in different levels to diagnose epilepsy. We need to provide minimum facilities that will help. Of course, integrated in local health systems. We cannot come down with a black box, vertical black box, to suddenly help epilepsy. We need to integrate it to whatever is existent. And we then need to make sure that drugs are available, affordable, and accessible. It's always a saying, and people will remember me saying this before, anywhere you get in Africa or Latin America, in the bush, in the Amazon, right in the middle of nowhere, you will always find the local beer. And, they don't seem to have a major distribution problem. But anti-epileptic medications, anti-seizure medications, like many other more specialist drugs, they have problems in distributing. But you could argue that it's the system around the health ecosystem that is partly responsible for this. So we have a number of challenges ahead with this current IGAP, which was brought out by the WHO and has epilepsy as a prototype to start. We are hoping to start seeing changes. My slight concern is that we are already some years down the line with the IGAP, and not much activity has happened. So we need to really play up to gain time, because if we want to reach the target set by IGAP, which is quite an improvement in the access to health by people with epilepsy, hopefully within a context of sort of universal health cover, we have a lot still to do.